Dr. Dareen Siri, and I'm an allergist immunologist at Midwest Allergy Sinus Asthma. I did my undergraduate studies at Columbia University in New York City. I then went and did medical school at the University of California in San Diego. My residency was at Brown University in Rhode Island, studying general internal medicine about all organ systems and how to treat the person. Then I did a subspecialty fellowship in allergy, asthma, immunology, and rheumatology at the University of South Florida in St. Petersburg and Tampa, Florida at All Children's Hospital, which is now known as Johns Hopkins Hospital. Asthma and allergy have always been a passion for me. It started actually for me in childhood when I had atopic dermatitis as a young person, and then subsequently I went to have allergic rhinitis, which was quite bad as far as seasonal allergies. I suffered a lot with my pregnancy. One of my 4 kids, the very first child I had the worst nasal and sinus symptoms. And when I was in medical school, I had full-blown anaphylaxis due to my latex allergy. So allergy, asthma, and immunology is very personal to my heart because I've suffered so many of these allergic diseases. It combines the science, immunology, some really esoteric, interesting scientific facts, along with treating the whole patient. And both young as well as older people, adults, and even the elderly can be affected by allergies and asthma. And certainly it is able to prevent disease as well as treat disease. So I think all those aspects of allergy and immunology are really quite interesting to me. At Midwest Allergy Sinus Asthma, we try to explore all parts of the person. So it starts with physical examination and a history taking, which means that we talk about things that might trigger you, environmental changes that you've had, problems that have led you to this diagnosis, how long you've had it. Maybe there was a childhood history if you're an adult. And we talk about all those aspects as well as your diet, nutrition, your current status of health. And then we use diagnostic procedures such as skin testing, breathing tests, endoscopy, and all sorts of things, chemical patch tests to kind of figure out what the trigger or the problem is. Finally, we'll give you a treatment plan, which includes basically talking about the reduction in the environment, immunotherapy, ways to change and permanently decrease those allergen problems if that's available, and maybe other ways to change or desensitize. We do that both with environmentals and foods. And certainly we talk about medications. We believe in reducing medications and using as little as you need, but at the same time the medications work well and can certainly make a huge impact on patients. So we try to be as judicious as possible and talk about the side effects of the medications that we use. Certainly diet, exercise, and nutrition are always a part of that and creating good health, and so that may be a component of the things that we talk about as well. So at Midwest Allergy Asthma, again, it's about solving problems, seeking and identifying solutions for sure to those distinct problems that each person has, but also to talk about general health and to treat patients as we would our own family. We also have an arm of clinical research, which we're very proud of. We've done some fantastic trials here, some pivotal trials in many different areas, including eczema, psoriasis, asthma, desensitization, food allergies, and desensitization. So hopefully people out there can become a part of that as well. One thing that a lot of patients don't know is that I love to travel. I've traveled internationally. I've visited about 40 countries. I have 4 children. My husband and I just love taking our kids to travel with us, so they've started traveling internationally as well. And along with travel comes, enjoyment and learning about other cultures, history, and of course eating. Because I love to cook and I love to eat, which is why my husband actually is a pastry chef and makes all sorts of delicious desserts for us at home.